If you're over 65, you've likely been told to get your blood pressure down. But to what number? 120, 140? The answer isn't one size fits all, and getting it wrong can be dangerous. When it comes to health in our golden years, few numbers are as important, or as confusing, as blood pressure. If you're a senior, or you care for someone who is, you've probably wondered, what's the ideal blood pressure for older adults? Is there a single magic number that everyone should aim for? Or does it depend on your age, health, and lifestyle? Today we're going to uncover the truth about the best blood pressure for seniors, and why the answer is more nuanced than you might think. For decades, the medical community promoted a one-size-fits-all approach. The gold standard was 120 over 80 millimeters of mercury, often written as 120/80 mmHg. This number was considered the ideal for adults of all ages, and doctors worked hard to help patients reach it. But as research evolved, experts began to question whether this aggressive target was truly best for everyone, especially for older adults whose bodies and health needs are different from those of younger people. Modern geriatric medicine has revealed a more nuanced truth. As we age, our blood vessels naturally become less flexible, and our bodies may respond differently to medications and lifestyle changes. What's safe and effective for a 40-year-old may not be the same for someone in their 70s or 80s. In fact, aiming for too low a blood pressure in seniors can sometimes cause dizziness, falls, or even reduce blood flow to vital organs. That's why today's guidelines take a more individualized approach, considering each person's overall health, activity level, and risk factors. So, what do the latest recommendations say? For healthy, active seniors in their 60s and early 70s, a target of less than 130 over 80 millimeters of mercury is often recommended. This level helps protect the heart, brain, and kidneys from long-term damage caused by high blood pressure, also known as hypertension. But it's important to remember that these numbers are not set in stone. If you're older, have multiple health conditions, or are at risk of falls, your doctor may suggest a slightly higher target to keep you safe and comfortable. Why does blood pressure matter so much? High blood pressure is often called the silent killer because it usually has no symptoms, yet it can quietly damage your arteries, heart, brain, and kidneys over time. For seniors, uncontrolled hypertension is a leading cause of heart attacks, strokes, heart failure, kidney disease, and even vision loss. That's why regular monitoring and management are so important, especially as we age. But what about low blood pressure? While high blood pressure is dangerous, blood pressure that's too low can also be risky for seniors. Symptoms like dizziness, fainting, blurred vision, and confusion can increase the risk of falls and injuries. In some cases, low blood pressure can reduce blood flow to the brain and other organs, leading to serious complications. That's why it's crucial to find a balance that keeps your blood pressure in a healthy range, neither too high nor too low. So how do you achieve and maintain healthy blood pressure as a senior? The first step is regular monitoring. Home blood pressure monitors are widely available and easy to use. Keeping a log of your readings can help your doctor spot trends and make adjustments to your treatment plan. It's also important to have your blood pressure checked at every doctor's visit, and to share any symptoms or concerns you may have. Lifestyle changes can make a big difference too. Eating a balanced diet that's low in salt and rich in fruits, vegetables, whole grains, and lean proteins can help lower blood pressure naturally. Regular physical activity like walking, swimming, or gentle yoga keeps your heart and blood vessels healthy. Managing stress, getting enough sleep, and avoiding tobacco and excessive alcohol are also key steps. For some seniors, medication may be necessary, and it's important to take it exactly as prescribed. Remember, everyone is different. The best blood pressure for you depends on your age, overall health, and personal risk factors. Work closely with your healthcare team to set a target that's right for you, and don't be afraid to ask questions or discuss any side effects you experience. With the right approach, you can protect your heart, brain, and kidneys, and enjoy a healthier, more active life as you age. In summary, while the old 120 over 80 rule was once the standard for everyone, modern medicine recognizes that seniors need a more personalized approach. For many healthy, active, older adults, aiming for less than 130 over 80 is a good goal, but your ideal number may be different. The most important thing is to work with your doctor, monitor your blood pressure regularly, and make healthy choices every day. By doing so, you can help ensure your golden years are as vibrant and fulfilling as possible. However, Here's the critical truth many miss. When it comes to managing blood pressure, especially in older adults, more is not always better. In fact, aggressively lowering blood pressure can sometimes do more harm than good, particularly for certain groups of people. Let's take a closer look at why this is the case, and what you or your loved ones should know before making decisions about blood pressure treatment. For frail seniors over 80, or those with multiple medical conditions, pushing blood pressure too low, below 130/70 millimeters of mercury, can be harmful. These individuals often have bodies that are less resilient to rapid changes in blood pressure, and their organs may not tolerate the same levels of medication as younger, healthier adults. Many seniors in this group are already dealing with a complex mix of health issues, such as heart disease, diabetes, arthritis, or cognitive decline. Adding aggressive blood pressure treatment to the mix can tip the balance in the wrong direction. Imagine an elderly person who is already struggling with mobility, perhaps using a walker or needing help to get out of a chair. If their blood pressure drops too low, even simple activities like standing up or walking across the room can become dangerous. The body relies on a certain amount of blood pressure to keep the brain and other organs well supplied with oxygen and nutrients. When blood pressure falls below a safe threshold, the risk of fainting, dizziness, and falls increases dramatically. For seniors, a fall can be catastrophic, leading to broken bones, hospitalizations, and a loss of independence. It's not just about falls, either. Overtreating blood pressure in frail seniors can also put extra strain on the kidneys, which are already more vulnerable with age. The kidneys need a steady flow of blood to function properly, and if blood pressure is pushed too low, they may not get enough. This can lead to a decline in kidney function, which in turn can cause a cascade of other health problems, including fluid buildup, confusion, and even heart failure. Another important consideration is the number of medications many seniors are already taking. It's not uncommon for older adults to be on 5, 10, or even more prescription drugs. Each new medication adds to the risk of side effects and drug interactions. Blood pressure medications in particular can interact with other drugs in ways that increase the risk of dizziness, dehydration, and confusion. For someone who is already frail, these side effects can be especially dangerous. The consequences of overtreating blood pressure in this population are real and serious. Dizziness is one of the most common side effects, and it can strike suddenly, without warning. A senior who feels lightheaded may lose their balance and fall, sometimes resulting in fractures of the hip, wrist, or spine. These injuries can require surgery, long hospital stays, and months of rehabilitation. In some cases, a single fall can mark the beginning of a downward spiral in health, leading to a loss of independence and a move to assisted living or a nursing home. Hospitalizations for falls and fractures are not only traumatic for the individual, but they also place a heavy burden on families and the healthcare system. Emergency room visits, surgeries, and rehabilitation are costly and disruptive. And for seniors, the emotional toll of losing mobility or independence can be devastating. It's important to remember that the goal of blood pressure treatment is not just to hit a number on a chart, but to help people live longer, healthier, and more fulfilling lives. Kidney problems are another hidden danger of overtreating blood pressure. When blood pressure drops too low, the kidneys may not be able to filter waste products from the blood effectively. This can lead to a buildup of toxins in the body, causing symptoms like fatigue, confusion, and swelling in the legs and feet. In severe cases, kidney failure can occur, requiring dialysis or even a kidney transplant. For frail seniors, these treatments may not be an option, and the focus shifts to comfort and quality of life. It's also worth noting that some seniors may experience episodes of low blood pressure, known as hypotension, even without aggressive treatment. This can happen after meals, when standing up quickly, or during illness. Adding strong blood pressure medications on top of these natural fluctuations can make the problem worse. That's why it's so important for doctors to take a holistic view of each patient's health, rather than relying solely on blood pressure readings. For this group, a target of under 140/90 millimeters of mercury may be safer and more appropriate. This slightly higher target allows for a margin of safety, reducing the risk of dangerous side effects while still providing protection against strokes and heart attacks. It's a more individualized approach that takes into account the unique needs and vulnerabilities of older adults. Family members and caregivers should be part of these conversations, helping to weigh the risks and benefits of different treatment options. If you or a loved one is over 80, or living with multiple health conditions, it's important to have an open and honest discussion with your healthcare provider about blood pressure goals. Ask about the risks and benefits of different treatment strategies, and don't be afraid to speak up if you notice side effects like dizziness, confusion, or changes in kidney function. Remember, the goal is not just to lower blood pressure but to support overall health and well-being. In summary, while controlling high blood pressure is important, overtreating it in frail seniors can lead to serious complications. A more moderate approach, with careful monitoring and regular check-ins, can help ensure that treatment does more good than harm. By working together with your healthcare team, you can find the right balance and make informed choices that support a longer, healthier, and more independent life. When we talk about blood pressure, most people immediately think of the top number, the systolic pressure. It's the one you hear about most often, the one that gets the headlines, and the one that's usually the focus of those big bold numbers on your doctor's chart. But let's pause for a moment and look at the other number, the one that sometimes gets overlooked. The diastolic pressure, or the bottom number. This number, though it may seem less important, actually plays a crucial role in your heart health, especially as you age. The diastolic pressure measures the force of blood in your arteries when your heart is resting between beats. It's a window into how well your blood vessels are functioning and how much pressure your heart is under, even when it's not actively pumping. For many people, especially older adults, this number can be just as important, if not more so, than the systolic pressure. Let's break it down a bit further. If your diastolic pressure drops below 60 millimeters of mercury, it's a red flag. Why? Because this can mean your heart isn't getting enough blood flow during those crucial moments of rest between beats. Imagine your heart as a hard-working engine. It needs fuel not just when it's revving up, but also when it's idling. If the pressure drops too low, the heart muscle itself may not receive enough oxygen-rich blood, especially if you already have narrowed arteries from coronary artery disease. This can increase your risk of heart attacks, arrhythmias, and other serious complications. It's not just a number on a chart, it's a signal that your heart may be struggling to get the nourishment it needs. And for people with existing heart conditions, this risk is even higher. That's why it's so important to pay attention to both numbers, not just the one that seems to get all the attention. Now, here's where things get really interesting and really personal. There's a common misconception that there's a single ideal blood pressure that everyone should aim for, like a magic number that guarantees perfect health. But the truth is, your best blood pressure is not a one-size-fits-all target. It's a personalized goal that you and your doctor should set together, based on your unique health profile, your lifestyle, and your specific risks. Think of it like tailoring a suit. What fits one person perfectly might be completely wrong for someone else. Your age, your medical history, your family history, and even your daily activities all play a role in determining what's safe and healthy for you. For example, someone who is very active and has no other health problems might be able to tolerate a lower blood pressure, while someone with a history of heart disease or who is prone to dizziness might need a higher target to stay safe. This is why it's so important to have an open, honest conversation with your healthcare provider about what's right for you. When you and your doctor are setting your blood pressure target, there are several key factors to consider. First, your overall health. Do you have other medical conditions, like diabetes, kidney disease, or a history of strokes? These can all influence what your ideal blood pressure should be. Second, the medications you're taking. Some drugs can lower your blood pressure as a side effect, while others might raise it. It's important to look at the whole picture, not just one number in isolation. Third, your risk of falls. This is especially important for older adults. If your blood pressure is too low, you might feel dizzy or lightheaded when you stand up, increasing your risk of falling and potentially suffering a serious injury. Your doctor will also consider your lifestyle, how active you are, what you eat, how much salt you consume, and whether you smoke or drink alcohol. All of these factors come together to create a personalized blood pressure target that's designed to keep you healthy and safe. It's important to remember that aggressive treatment to lower blood pressure isn't always the best approach. In fact, pushing your numbers too low without considering your individual circumstances can actually do more harm than good. For example, if you're taking multiple medications to lower your blood pressure and you start experiencing dizziness, fatigue, or confusion, it could be a sign that your blood pressure is too low for your body's needs. This can lead to falls, fainting, and even reduce blood flow to vital organs like your brain and kidneys. That's why it's so important to work closely with your healthcare team to find the right balance. Sometimes, a slightly higher blood pressure might be safer for you, especially if it means you're less likely to fall or experience other side effects. The goal is not just to hit a number, but to optimize your overall health and quality of life. So, don't be afraid to ask questions, share your concerns, and be an active participant in your care. Your health is unique, and your treatment should be too. Let's take a moment to talk about how you can be proactive in managing your blood pressure. One of the most powerful things you can do is to keep a regular log of your readings at home. This gives you and your doctor a more complete picture of how your blood pressure changes throughout the day and in different situations. It can help identify patterns, such as higher readings in the morning or after certain activities, and can guide adjustments to your treatment plan. Make sure to bring your log to every appointment and discuss any changes or concerns you notice. Remember, your doctor is your partner in this journey, and the more information you can provide, the better they can help you. Lifestyle changes can also make a big difference in managing your blood pressure. Eating a balanced diet that's low in salt and rich in fruits, vegetables, and whole grains can help keep your numbers in a healthy range. Regular physical activity, even something as simple as a daily walk or gentle stretching, can strengthen your heart and improve your circulation. If you smoke, quitting is one of the best things you can do for your heart health, and if you drink alcohol, try to do so in moderation. These changes might seem small, but over time, they can have a big impact on your blood pressure and your overall well-being. Medications are another important tool in managing blood pressure, but they're not a one-size-fits-all solution either. There are many different types of blood pressure medications, and each works in a slightly different way. Some help your body get rid of excess salt and water, while others relax your blood vessels or slow your heart rate. Your doctor will choose the medication or combination of medications that's best for you based on your health history, other medications you're taking, and how your body responds. It's important to take your medications exactly as prescribed and to let your doctor know if you experience any side effects. Never stop taking a medication without talking to your doctor first, even if you feel fine. Stopping suddenly can cause your blood pressure to spike and increase your risk of serious complications. Support from family and friends can also play a big role in managing your blood pressure. Don't hesitate to reach out for help if you need it, whether it's someone to go with you to appointments, help you remember to take your medications, or just listen when you have concerns. Staying connected and having a strong support system can make it easier to stick to your treatment plan and make healthy choices. And remember, you're not alone. There are many resources available, from community health programs to online support groups, that can provide information, encouragement, and practical tips. In the end, managing your blood pressure is about more than just numbers. It's about understanding your body, working with your healthcare team, and making choices that support your long-term health and happiness. There's no single right answer, only what's right for you. By taking an active role in your care, staying informed, and making small positive changes, you can protect your heart and enjoy a healthier, more vibrant life. So, remember, your best blood pressure is the one that's tailored to you, and you have the power to make a difference every day. This is vital information that every senior and caregiver must understand. Please, share this video with your friends, family, and in your community groups to spread this life-saving knowledge. For clear, trustworthy health information you can use, subscribe to our channel, and hit the notification bell. Your health is your greatest wealth. Let's protect it together.